the fallout from all of this on the Affordable Care Act and whether it can even remotely live up to its name right now. The Washington Examiner's healthcare reporter, Paige Winfield Cunningham, former Bush 41 campaign advisor Mark Serrano, Democratic strategist Adam Green. Adam, as the Democratic strategist here, do you worry that this could undo big poll leads Mrs. Clinton has enjoyed, or too little too late? What do you think?
Well, probably too little too late for 2016 purposes. But what 33 Democratic senators, Hillary Clinton, the Progressive Change Campaign Committee, and a bunch of other groups are pushing is actually more competition and accountability in the marketplace by having a public health insurance option like Medicare, something that's very popular with Republican, Democratic, and independent voters. And we see this as the solution to some of these woes, holding big insurance companies accountable as they try to pull out of these marketplaces. All
right, now, I know 11 Republicans, Mark, has said that's sort of like rearranging the deck chairs on the Titanic. What do you say?
Well, I say that, we were sold a lie from the very beginning. It's not that the administration didn't know how this is going to turn out or the marketplace turned out differently. It's that they bold-faced lied to us about the results of extended entitlements such as Obamacare.
And I'm going to give the benefit of the doubt on this, Mark, to think that they assume more young people would sign up, that they would entice more young people to, because you need young, healthy people paying into a system to pay for, well, people like me who get open heart surgery. So that didn't happen. So I'm wondering what that means now. We're stuck. How do we unstuck us?
Well, but that just proves that, it was a leap of faith from the very beginning, that they couldn't guarantee that young people would enter into the system. So it was flawed from the outset, whereas free market practices, are going to go in a totally different direction. And this notion that we're going to see more competition for Democrats is another falsehood, because Hillary Clinton completely embraced Bernie Sanders' single-payer concept. And so one way or another, if Hillary Clinton is elected, people will need to get used to even higher premiums than we're seeing already.
I hear you, but Paige, Republicans have to be careful on this, because if they want to junk it, then you're going to have millions of people who have coverage right now, millions of people who are paying a lot more for that coverage if they deign to keep it right now, millions of people paying penalties if they opt out right now. So what do Republicans do for them?
Well, I mean, I think that you kind of saw a hint of that recognition in the plan House Republicans released this summer, because there were some elements where they would gradually phase down the law, where in the past they've called for fully repealing it immediately. So I think that there is this sense that people have these benefits, but I don't think they're going to bite on the public option plan. I mean, it's true. Obama called for it last week, and it's something Democrats are really calling for as an antidote to this law. But you see Speaker Ryan saying that's not going to fly. He's not going to support any fixes. So I think politically speaking, you're going to see both parties really at odds over this public option idea.
No, they are already. Adam, the one thing I don't know your views on these corporate monopolies, but it seems that a lot of liberals, not all, but a lot, are okay when it comes to big healthcare monopolies, like a single payer, like big old government monopoly, but not when it comes to companies and whether they get too big for their britches. Am I getting that right?
Well, one of the big asks that progressives have of the Hillary Clinton administration, should there be one, is that we have way more robust antitrust enforcement, so that we have less monopolies and more competition in the marketplace. That would mean more jobs, higher wages, better prices, better quality goods for consumers.
But you're replacing companies with the government in that role. Do you really feel that good about that prospect?
No, I mean, look, if you ask Fox viewers whether they like the brand of Medicare, it's a pretty popular brand. It's not replacing doctors.
So we could have avoided all of this and all the problems that are associated with this with just beefing up Medicare.
Well, part of it here is, again, a public option that competes with private insurers like Medicare. And the one thing I want to say is that Donald Trump actually said something that's either very erroneous or very new in that clip you had before. He said that his employees are having trouble with Obamacare. I'm an employer. We have an organization, the Progressive Change Campaign Committee. We are barred from the exchanges. Employers can't get Obamacare right now, and that's partly why we don't have enough young people entering the marketplace. If anything, we need to open up the marketplace and allow
but that's not going to happen. That's never going to happen, Neil, and I'll tell you why. Because Elizabeth Warren has made it very, very clear. She will be the agent of change in a Clinton administration. There is no way she's going to let Hillary Clinton get away with proposing anything but a single-payer plan. That's the pressure that Hillary Clinton will be under. Will be from her own left.
Warren supports a public option like Medicare that competes with private insurance.
Well, I've heard
there's going to be no competition from this administration.
I understand,
if it's a Clinton administration.
I'll give you the final word on this, Paige. Something's got to be done. Now, the argument that has been raised, we need a public payer option. Maybe they knew that all along. This would be where we'd go. Other Republicans say, you know, stop this, start from scratch. You alluded to the fact they've got to cushion the blow by either keeping millions who have insurance on there right now and finding them or transporting to this new system. I don't know what it is, but it's safe to say both candidates are looking at having to make substantial changes, right?
Well, yeah, I think there's a recognition something has to be done, but the question is how much political capital is the Clinton administration also going to want to spend on this? I mean, there's some small bore things that she could do, like tightening up the special enrollment periods and sort of being stricter around
You're making the
when
assumption,
people can
of course,
sign up.
she wins.
Right,
Don't
of
make
course.
that
Assuming
assumption.
she wins, of course. We have a different scenario if Trump wins
Right.
altogether, which I think would put Republicans in a much tighter spot because, of course, then it's up to them as to what they're going to replace it with. But I think there's a recognition.
Free market practices. They'll bring competition back to the system.
Paige, finish that thought.
Well, I just think that, yeah, there's a recognition. I mean, I think that in itself is really significant. The conversation was always about whether Obamacare is healthy and working as intended, but now everyone recognizes it's sick, and the debate is whether it's on its deathbed or whether it just, you know, has a bad cold. So I think you're going to see something next year, but it really depends on whether Trump or Hillary wins.
All right. I would use another analogy. You could stick a syringe in it as it's known. It's done. But I think your analogy is far better and airtight. All right, guys, I want to thank all of you. Seriously, I appreciate you taking the time.